So I think we're going to start. So hello, everyone. Thank you for taking part in today's webinar. Today's webinar is going to be on concussion. It will be presented by Tiffany Hunting, who's the head therapist of the national team since 2016. Just a quick up and a kind of coincidence. Starting today starts the Canadian Concussion Awareness Week. It's until next week, so basically we're right on time. So before we start, some rules to keep in mind during today's webinar. So this webinar will be recorded, will be available on the Dailymotion channel of Judo Canada. As you may have seen, all participants will be muted. If you have a question, you can unmute yourself. For general questions, please use the chat. And if you use the chat, please do so that your question will be addressed to everyone. And again, the presentation that you will see today will also be available on the Judo Canada website. So I think we can start now. I will let Tiffany take control and present today's webinar.
Happy Sunday to everyone. Thanks for joining us today. So as Nicolas mentioned, today's webinar is going to be on concussion and the management and prevention of concussion. So before we start, we're just going to ask a couple of poll questions just to see who we have in our audience today. So I'll get Nicolas, if you can send off those poll questions. We'll give a few seconds for people to answer. All right, so it looks like most people have responded. All right. I think we can go to the next question, Nicolas. So as we see, there's a majority of coaches, a few administrators, and someone who's others. I'm not sure if they're a referee or another person involved with judo, but welcome. Second question, Nicolas. All right. Seems like most people have answered, so we can end the poll. All right, so it looks like it is a split almost about 40-60 down with down the middle for people who have some notions of concussion, other people who deem themselves they have good knowledge of concussion. Okay, so we will start. So I will start today's webinar by giving a brief review of what concussion is, some basic information. Then I'm going to go through the concussion response plan that Judo Canada has developed, and we're going to go finishing off with some prevention and resources for you. So concussion information. So unfortunately, this will be a review for most of you, but bear with me. It's just to set the scene for the rest of the talk. So the definition of a concussion is a type of traumatic brain injury caused by a bump, blow, jolt to the head, face, neck, or body that causes the head and brain to move rapidly back and forth and can alter the way the brain normally functions. So some of the signs and symptoms that we can see or observe or be told from the athlete that they have can fall into one of the four following categories. So a physical symptom or sign, thinking and remembering, mood, or sleep. Again, the ones that are listed here are just a few of the symptoms that can be, the signs and symptoms that can be observed. So please refer to any of the reference documents for an exhaustive list. Something to keep in mind is that at times these signs and symptoms will immediately become apparent for the athlete after they have had an injury. Otherwise, it may be delayed between 24 and 48 hours before the symptoms can be apparent. So something to keep in mind, that though you see a suspected mechanism of injury and that person says that they're fine, they don't have any symptoms, it is important to make sure that we are monitoring them and assessing them to see if the symptoms do occur in the following days. So that was my brief overview. I don't want to, it's not a lecture on concussion and all the mechanisms and what happens during a concussion. It's really more what I wanted to bring about is how we can have a response to a concussion. So the concussion response plan. So we made a concussion response plan is kind of like a trail guide, a map for us to follow if we suspect there has been an impact that could result in a concussion. And the reason why we made this, it's more just as a guideline for people to follow, to kind of know where to go next. What's the next step to take during concussion recovery? This schema is available for download on the Judo Canada website. The web link is on below here, but it's also, I talk about the resources at the end and the link will be there as well. So this is free for you to download from the Judo Canada concussion webpage. So we'll start off at the top, that there's an impact. So the impact can be, like I mentioned in the definition, it could be an impact to the head, the neck, the face, or the body, where the force is then transmitted up to the head. It's important when there is an impact that the individual is removed from play, that someone who is responsible is told so that they can get assessed. So we understand that not all environments will have a medical personnel present at all trainings. So there is a tool that I will go over in detail called the Concussion Recognition Tool that was distributed to all clubs last fall with the guidelines for what a lay person, so a person without medical training, can do to help identify a concussion. I will go into more detail about the Concussion Recognition Tool in a few slides, but just to let you know, there is tools out there available for individuals who don't have medical training. Judo Canada also developed a remove from play concussion protocol that's also on our website that you can read through to find out the steps and what should be done in the event of a suspected mechanism of injury. So we have a suspected concussion. So that mechanism of injury that we saw is suspect, and we're concerned that this athlete might be having, might have sustained a concussion. So we were asked that we do an evaluation. If we're a trained medical person, we would usually do a SCAT. A SCAT 5 right now is the most common. So a SCAT is the sideline concussion assessment tool. This is done by trained healthcare professionals. So a lay person would be doing the concussion recognition tool, as I mentioned before. And this should be done on anyone who had a significant impact with that we suspect a concussion, that they report any symptoms that are related to a concussion, or that any signs are observed. So a symptom is what an individual would feel on the inside. So are they feeling nauseous? Are they feeling dizzy? Do they feel more excessively tired? Whereas a sign is something that we could observe. So we see that they have balance problems. We see that they look confused, that they have a blank stare, or perhaps that their ambulatory pattern, so how they're moving around, it looks a little bit unsteady. So those are what we observe. So signs are what we observe, and symptoms are what people tell us how they're feeling. So if the athlete reports any of these symptoms, or someone sees these signs, this is indicative that an athlete should be assessed with the concussion recognition tool. So here I'm going to go over what the concussion recognition tool looks like. So I know it's probably really small on your screen, but those clubs who received it last fall, you should all have had a copy. I think it was on an 8.5 by 11. If not, they're free for download. They're in the annex of our concussion removal from play protocol. If not, just Google CRT and you will be able to find a printable copy. So they're free to print. You're just not allowed to reproduce it in other formats or to sell it, but they're free to download and use for your own use. So this was developed by a panel of experts that they meet every about 4 years. So the one was supposed to meet last fall, but because of COVID, it's been delayed to this fall. So we might have an update coming out in early 2022, but we'll have to see if that comes out. So the CRT is divided into 4 different steps. The first step you can see is highlighted by a red box, and it's deemed the red flag step. So if any of the signs or symptoms that are indicated in the red flag box are present, it is crucial that an ambulance is called and the athlete be removed by an ambulance and brought to an emergency room for immediate assessment. The reason why this is the red flags is because these signs and symptoms are indicative of potentially a more serious brain or neck injury. So again, we always want to play on the safe side. We want our athletes to have an environment where they're safe and secure to come and train and participate in the sport that they love. So we want to make sure that we're erring on the side of caution here. So if any of those signs or symptoms in step 1 come up, it is ambulance and referred to the hospital. Step 2 are observable signs that the person who's doing the assessment or who saw the athlete when they were injured can observe. So things like lying motionless on the playing surface, slow to get up, feeling wobbly on their feet, disoriented, blank or vacant stare or look. They are stumbling all over the place, or they have a significant facial or head injury. So these are some observable signs that the evaluator will be able to see. Step 3 are symptoms. So this is what this athlete will subjectively report to you if they're feeling any of these symptoms. And step 4 is a quick memory assessment. So these are to be used in 12 years and older. If they're under 12 years of age, the questions are a little bit, it's not valid for them. So this is really for the 12 and older age group. So some of the questions are not really pertinent to the sport of judo. It was made more based on a team sport environment, but so we'll have to just modify some of the questions based on our situation. So the venue that works, you can ask where you're located or where you're training, what the dojo is. Which half is it now? It doesn't really work for judo, but you can ask what part of training you're in. Are you at the beginning, the middle, the end? Have we been doing drills? Have we been doing randori? Just questions on kind of the situation, the time frame that you're in now. Who scored last in the game? Again, that doesn't really happen in judo. We don't have only 1 or 2 scores. So you can ask who they fought the last randori, who scored, what techniques were they working on, et cetera, et cetera. So you just have to make the questions pertinent to your situation. Same thing, the last 2 questions are asking for more about retrogrades. They're asking for a little bit more long-term memory, what happened the previous week. So again, unless there was a competition the weekend before that you can question them on, maybe just ask them what event was last, or what they were working on last week, or if there is a special, it doesn't necessarily be pertaining to their sport. It could be what holiday did we just have last weekend? It could be Thanksgiving or Christmas, or just make it so it's about a week or so of memory that they have to recall. And instead of ask, did you win or lose that game? Just you can ask a detail about that you would be able to verify if that was correct or not. So again, this is just a tool for people who have non-healthcare background. It is not used as a diagnostic tool, but more of a screening tool to know if you have to refer the athlete immediately to the emergency room for immediate medical assessment, or if you're going to be sending them to their family doctor, or if they should be observed to see if symptoms develop. All right. So then we're going to move on to the red flags. So again, I talked about them a little bit when we went over on the last slide, but I'm going to go over them because these are the most important things. If any of these red flags are present, it is important that the athlete be transported immediately to the hospital by ambulance. So neck pain or tenderness, this is because there could be an injury to the cervical spine. We want to make sure we don't have any fractures in that area, because they can cause damage to our spinal cord. If someone has double vision, it could be indicative of an injury in the brain. Same thing, so weakness or tingling, should be or not of, or tingling and burning in the arms or legs could be indicative of an injury to the spinal cord or nervous system. Severe or increasing headache, again, this is a big indicating factor of potentially enlarging cerebral hematoma, so a bleeding in the brain. Seizure, convulsion, same thing, were indicative of something, a damage, an injury to the brain. Loss of consciousness or deteriorating conscious state. So if someone was fully conscious and able to communicate with you and tell you what was happening, but over time has either become drowsy or unable to answer questions correctly. This is cause for concern because we're wondering if there's something going on inside the brain. Vomiting. So vomiting one time is not an emergency. It's multiple times of vomiting. So 2 or more times vomiting after an injury, we would want to send them to the hospital because sometimes repeat vomiting could be related to, again, injury to the brain. And someone who has increasing restlessness or anxiousness, again, it's a fight or flight system response. So we're wondering if there's something more serious going on. So the big take-home message for this slide is if any of these red flags are present, this athlete should be seen immediately in the emergency room. So now that we've kind of ruled out who would be considered a serious emergency, these ones would be going to the hospital ASAP. They're really to be sent there to rule out for a more serious head or neck injury and for the emergency medical assessment. And these should be transported by ambulance. So we're back on the other side of our schema. So we did not have any red flags present. However, any suspected concussion should be assessed by a medical professional. And again, that's to rule out more serious forms of traumatic brain injuries, spine injuries, any medical issues, as well as neurological conditions that could present with concussion-like symptoms. And we want to make sure that if there's something more severe, that this athlete is being taken care of the best that we can. So currently in Canada, it is only a medical doctor or a nurse practitioner who has the ability to fully diagnose a concussion. So to actually give the diagnosis of a concussion, it's really limited to those 2 professionals. However, the Concussion Consortium of Canada has realized that not everyone has equal access to a medical doctor and nurse practitioners that easily. So they have made an exception for individuals who live in more remote areas to be able to communicate via a teleconference or a communication through a nurse or someone in a clinical setting to communicate with a doctor to get this diagnosis. And I'm not sure if there's anyone here from Quebec, but in the province of Quebec, the College of Medicine, College of Doctors, so Collège de Médecine de Québec, and the Ordre de Physiothérapeutes de Québec, so the physiotherapy professional order, have made an agreement that if a physiotherapist has met certain criteria, some of which being regularly training in concussion, often sees athletes with concussion, follows a team longitudinally, so they follow the team throughout time, could also take on some of the assessment roles, but physiotherapists are not allowed to pose the diagnosis. So it will vary a little bit from each region, but in general, a diagnosis should be given by a medical doctor or nurse practitioner. So something that we developed over the last year is called the concussion report. So it's a new online form that we're going to be asking individuals to complete if there's a concussion that has occurred. So we made this form. It's really there just to obtain knowledge, to get some data, to see how concussions are occurring in Canada that are related to judo, whether it's competition or training activities. And so this online form should be completed anytime a concussion is suspected following an incident that occurred during judo-related activity. And it's really just to get that objective measure, the data around how and when they're coming in order to better plan our preventative strategies. So again, we're using this as a tool to help our planning for how we can prevent concussions. So my next slide here is this is just the beginning of what the concussion reporting form looks like. If you give me 2 seconds, I'm just going to switch my screen and we're going to go look at what the form looks like. So here we go. Nicola, can you tell me if my screen has gone up to the web page?
Yes.
Perfect. Okay. So I'm showing you now what the concussion reporting form looks like when you click on the link from the Judo Canada website. So there's a brief introduction of what it's about. I just explained it again. It's to get some data so we can better plan for concussions and have better prevention in the future. There's been lots of research around concussions, but very little specifically to judo and almost none in Canada. So again, this is why we're trying to get this information. So just letting people know, I'm logged into my shared account, so you will not have your email here. It just says here that this is not going to be shared. So again, don't worry that it's mine. It won't be like that when you click on the form. So for identification purposes, we want to keep this as confidential as possible. So we're not asking for anyone's name. We're asking actually for their Judo Canada ID member number. The reason why we're asking for the member number is just to see if concussions occur to the same individual over a specific period of time. Again, it's not to call out on that athlete or call out on that individual. It's really just to see how often concussions occur per person. So we're going to ask for their ID, the date of birth, the gender of the individual, the level that they participate judo in. So are they a national international athlete, a provincial athlete, or a recreational athlete? The date and time that the injury occurred, a little bit of context of how it occurred. So the type of activity, was the beginning, the middle, of the end of the training. If there's some of these things they are not pertinent, so it does not apply, or you can input some additional information for us. If it was happening as part of a training camp, if the technique or the description of how the injury happened is known, you can indicate that. Were they the uki or the tori? And were there any contributing factors such as poor conditioning, mismatched age, mismatched partner with weight or skill, equipment failure? So that can mean anything in the environment. They fell off the mat, they hit a post, they ran into something else. If they're in the gym, the bar fell on them, etc., etc. Again, you can also give us some more details if needed in the box below. All right, and then we're asking for the person who completed the form just to identify themselves and give them the contact information and indicate who they are. So this can be filled out by the athlete themselves, a coach, an official, a medical staff, strength and conditioning specialist, or a parent, or other people administrative. It's just we're asking it to be filled out just so we have a better idea of what's going on for concussions in Canada. All right, so I'm going to go back to my PowerPoint slide here. All right, so once a concussion has been confirmed or diagnosed, we have a sequential return to learn and play. So these are our return to learn and return to play protocols. So it's important to follow these protocols because they're really graded. So they progressively add more challenge to the brain and to the physical capacity of the body. And if we go from 0 to 101 steps, sometimes we don't know, and symptoms return, we don't know what causes symptoms to return, and we don't just know if it was just too early for them to return. So doing this graded approach will actually give a transition back to that full training. So in my next few slides, I'm going to show you one of the return to learn and return to play protocols that Judo Canada has. To let you know, we do have 2 return to play protocols, one that's for the elite athlete or high level athlete, and one is more for based on club and community. The elite athlete one is really targeting those individuals who are training 4 to 5 times a week and about a 2-hour training per training time. So it's really those high level athletes that we're targeting, and it's not to say that that protocol is better than the other one. It's just it gives very specific numbers of times and reps and sets that an individual should be doing the exercises in, whereas the club and community, it's more of a percentage or a proportion of whatever their training was prior to the concussion. So the club and community one gives a little bit more flexibility based on the level of the athlete at the time of injury. Okay, so we're going to go through the protocol a little bit together. I'm not going to read through them all. I'm just going to go through some of the main highlighted areas. What is really important to know is that throughout the protocol, signs and symptoms should be monitored throughout, because we want to make sure that we're passing through the steps sequentially, but that they have achieved the step without any signs or symptoms. Okay, so here we have the example of the community, the club community return to learn, return to play protocol. So you can see that the return to learn and return to play protocol are parallel to each other. So we don't have to do one and then the other. They can be done both at the same time. And they start with an initial 24 to 48 hour initial rest period. This is for our, our 13 and up group. If it is someone who is younger than 13, usually the medical professional who has diagnosed them with a concussion may ask them to have a little bit longer initial rest period or give them different information regarding the rest period. So for the 13 and up group, we're going to say it's 24 to 48 hours unless the medical professional has asked for something different. After that initial rest period, they're allowed to start step 1, which is symptom limiting activities. So this is their activities that they do daily. So activities of daily living and some of the accessory activities of daily living. So they can read, they can play on their phone, they can watch TV, play on their computer, read a book, do some daily household chores, etc., etc. But what is important is that we start at small increments. We want to start with 5 to 15 minute increments at a time. And if they're successfully able to do those tasks for that period of time, then you can slowly increase the amount of time that the individual is doing these activities, building up slowly to see what their tolerance is. So once step 1 has been completed, then we can start step 2. And this is where return to learn and return to play will be in parallel for each other. So return to step 2 for return to learn is that they're doing some classroom activities, but outside the classroom. So it might be some work on their own. I'm not going to go through all the details of how much time and what the examples are. It's in the protocol for you to read, but just you see that it's, beginning steps. They're starting to do some cognitive work, whereas on the physical side, they're doing some light aerobic activity. All right, so if they've been successfully completed their step 2s in both return to learn and return to play, we're going to go into our step 3. So step 3 for return to learn is divided into 2 parts. So you have return to school part-time with light workload and return to school part-time with moderate workload for step 3 in the return to play, return to learn. For the return to play, we're going more into sport-specific exercises. So the total duration of this step should be 50% of the regular practice time that the individual is used to. So it's important to know that there should be no lifting, throwing, or power drills, and no Sinkaku or other choking techniques should be done as an UK. They can do them as a Tori, but not as an UK. Furthermore, it's important also to take into account that no new technical aspects should be taught at this point, just because adding a new technique for them to learn is putting cognitive load into the training as well. Whereas if it's something that they're used to doing, their body is just going to remember how to do it. So by teaching them something new, we're actually making it more difficult for them. All right, so once we've successfully passed step 3, we move on to step 4. So step 4, again, return to learn has 2 parts, A and B. So one is return to school full-time, nearly normal workload. And then step B is the full workload. For step 4 in judo-specific training, it's about 3/4 of the regular practice time. Here we're increasing the intensity of the drills, the technical aspect, the difficulty. Again, there's no maximal efforts. We should also be cautious that in the judo, they're not doing any rolling, somersaults, break falls, or any partner carry exercises. They shouldn't be holding their breath. We call that a Valsalva maneuver, when they hold their breath and kind of have to force through abdominals to brace themselves. If this individual had been doing some resistance training, they may restart with some limitations, but they may restart some of their gym work as well. So after we've passed our step 4, this is where we have an absolute medical clearance is needed. So we need to have a medical clearance here between step 4 and 5 before we go on to step 5, because in step 5, we are going to be starting our risky activities where there's contact. So after you finish step 4B for return to learn, you're back to school full time. So then it's only the return to sport that continues. So 5A is returning to training with controlled contact. 5B is full contact training. And step C, so 5B is a full training, and step 6 is a return to sport and competition. So a lot of times people ask, what's the difference between 5B and 6? So 5B, again, you have no limitations on your training. It's a full training. Or step 6, it's almost as if it's for the level of intensity that you would be going to a competition. So it's sometimes a little bit more intensity or a little bit more volume than you would have in a normal everyday training. So other things, it's described in the protocols. There's an instruction sheet on the first page of the protocols, but each step should be a duration of 24 hours minimal. So if you do step A on a Monday, 5A on a Monday, you have to wait until Tuesday to do your step 5B. If someone does have symptoms at one of the steps, you stop when the symptoms appear. You let them rest for 24 hours before returning to reattempting the step. If someone fails the step twice, I would refer them back to a medical doctor for them to be reassessed to see why they're potentially having these symptoms come back. So that leads me to my next slide. It's sometimes it does occur that people have concussion symptoms lasting longer than a normal recovery. So this is what we kind of deem now, we coined the term persistent post-concussion symptoms. So this is for adults where the symptoms last longer than 10 to 14 days and for over a month in children. So there could be many reasons why this occurs, and that's why we have to refer back to a medical practitioner to make sure that the person is getting the correct evaluation and treatment necessary. So there could be different reasons. Some of the possible contributors to why the symptoms are persisting is that there could be symptoms related to the cervical spine, so the neck region. There could be vestibular or ocular motor influences, so from the inner ear or from the eyes. Neuropsychological, so that's within the brain, the decision-making, rationale, spontaneity, and quick reactions. And then also sometimes there could be disruptions in the central nervous system on the autonomic side. So we have the autonomic is responsible for regulating our heart rate, our blood pressure, our respiration rate. So sometimes with the concussion, those systems can be affected as well. And ends up that the person will have some persistent symptoms. So the management of this is relative risk. It doesn't mean you have to stop all activities and have bed rest. It's managing to doing activities that are sub-threshold of the symptoms or activities that do not cause the symptoms. So someone might be very able to do lots of cardio work, like aerobic training, but when they start adding some sport-specific movements or different positions, this is what sets off their symptoms. So we try to manage it by doing as much as they can without provoking the symptoms. Reassurance. Usually individuals who have persistent symptoms are quite anxious and nervous. They're worried that they'll never get back to their sport. They're worried that they've changed their life forever. Reassure them, support them, give them what they need to have the support, refer them to any resources if they're available. However, this type of athlete usually is going to be taken over for treatment by interdisciplinary approach. So this means that there'll be multiple healthcare professionals, each with different specialties, working on the aspects that need to be worked on for this individual. So really depending on who this individual is and what symptoms and what systems are somewhat affected causing the persistent concussion symptoms, this is how we're gonna kind of manage it going further. And so usually these individuals will have a more extensive assessment just to find out the potential causes of these symptoms. All right, so let's assume we don't have any persistent symptoms and we've gotten our medical clearance. So we've moved on and we've done our contact sport or contact training. So our ones with, we've been throwing and we're doing randori. So medical clearance is needed across the board for this. However, as mentioned in Quebec, they do have an agreement between the Ordre des Physiothérapeutes de Québec, so the Physiotherapy Professional Order, and the College of Quebec Doctors. The individual who is part of the physiotherapy order does have to meet certain criteria to be eligible to provide this care, as well as the person who has the concussion has to also meet certain criteria. Example, just to give you a few, if the individual has as the second or more concussion, they will need to be referred to a medical doctor. If they've had a concussion in the last 12 months, they have to be referred to a doctor. If they have any comorbidities related to any mental health issues, they're also referred to a doctor. And if obviously the symptoms are persisting for a period of time, for a longer period of time, they should be referred to the doctor. So to be aware, some different sports teams or associations will require a third medical assessment at the end of the protocol, but this is to be verified with your particular organization and federation about this. Give an example, some sports that are related to schools will ask for this third medical assessment just to make sure that the athlete has fully completed the protocol and is not remaining in the step 5A and 5B. All right. And then so we have our full return to sport afterwards. So they're here to play, there's no longer any restrictions. We have to have a gradual return depending on how long the athlete was actually out and been injured. So I like to usually divide it into 3 different kind of phases, even though they're fully returned to sport. So I say your return to play, so you're training. Return to sport is full. They're doing up to like training as if they are going to compete, and then return to performance is being able to successfully compete at a competition. So we have to follow a gradual approach, really similar to any type of injury where an athlete has been off training for a period of time. It's not a great idea for them to start back a competition after they've been out for two to 3 weeks. You want to gradually get them back, get them reconditioned, and get them back in the ability to be able to perform. So I'll take a break here. I just talked about our new kind of not protocol, but our action plan that we've had regarding concussions, to see if people have any questions about that. So Nicola, was there anything in the chat that came up?
No.
No. So feel free to write your questions in the chat, or if you want, you can unmute yourself and just speak, and I will answer live.
This is Don Corrigal in BC. A question has come up with regard to an athlete that has had multiple concussion events. At what point do you recommend that they in fact stop training totally? Okay, so there's been some research on this throughout the world, and they've come to the consensus that there's no right or wrong number. So it really depends on the individual. Some people seem to be a little bit more fragile than others when it comes to concussions. Really, what is important is how they have recovered from their concussions and what kind of symptoms they have. It would be up to their treating medical doctor to make the decision or have that conversation with the athlete, whether or not they should be thinking maybe of moving on to a different sport. Again, someone who takes multiple months to recover and then fully recovers and goes back to sport and has another concussion very short time after, you know, sometimes it kind of leads to that discussion of, is this really the best thing for your health? But there's no black or white, you know, the cutoff is at this many concussions versus this many concussions. It's really variable on the person and seeing their clinical portrait on how long it takes them to fully recover. And if they do have any symptoms that are lingering, what kind of impact, is it a light impact that would be usually considered a subconcussive impact versus a very large impact. So unfortunately, I can't give you a full answer on that one, but it's really case dependent, and it should be something that the individual speaks with their medical doctor. Did that give you enough of an answer? Yeah, it did. The sort of follow-up to that, what would you be looking for if you had somebody that had started to develop post-concussive syndrome, continued to want to train, and then moved into that long-term traumatic brain injury category? Where's the tipping point for that?
Okay, so I've done quite a bit of courses in concussions. So it really depends on what is the aggravating factor for this specific individual. So if they can do a lot of aerobic work, I might have them be doing, you know, pushing on the aerobic side. And what are the kind of the factors that set off their symptoms? Is it usually a visual? Is it something with movement? So it could be vestibular. Are we looking, you know, I try to get them as active as they can, but sub symptom threshold. In the meantime, while trying to train the system or repair or allow to heal the system that is causing the symptoms. If someone, you know, is really, if they've now fallen into, you know, the long-term traumatic brain injury category, unfortunately, there again, it's a decision that the individual will have to make with their treating medical doctor and whether or not it is safe for them to return fully to judo. Again, there's no right specific answer to say when this tipping point is, but again, there usually is some way to keep them active up to a certain level, like symptom threshold. But again, the brain is so complex, and concussions are kind of this like mysterious injury that we can't see on imaging, that it's kind of based on symptoms and how they react based on different tests and what levels that we push them at. So I know it seems like I'm just skating around and trying to, find, different questions to your question, but there is no specific answer. And someone who really wants to continue judo but continues to have symptoms, as a medical professional, I have to advise them that, listen, it's not the best choice, and that they should really discuss this with a medical doctor who has a lot of experience treating concussions.
Thank you.
You're welcome. Do we have any other questions before we move on? No. Okay, so I will move on to the next part, which is concussion prevention. So again, for the national team, and it is always the worst thing I have to do when I have to pull someone out from training, but I want to do it. The reason I do it is to make sure that they are healthy and going to be training in an environment that's safe for them. So concussion prevention is really based, the first main pillar that we have, the base, is education. So educating anyone involved, so coaches, athletes and their parents, officials, administrators, really everyone who's involved in judo should have a basis of education. I know that some provinces ask for a pre-season educational seminar or info letter that people sign that they've read, because knowing what a concussion is and being aware of it is the first way to recognize that something has happened, and then to be able to correctly assess and manage the case, because the best management will actually hopefully come out and have the best return to play for the athlete. We want them to, the more that people are aware, the more that they can, take action right away. So education is our basis for prevention. So unfortunately, it does happen quite often that individuals do tend to hide symptoms, or they try to push through symptoms and return to sport too quickly. So this is a common occurrence through all levels, all across the board for all sports. But what people don't understand is that a concussion is not the same as having just like a sore muscle. Your brain has a really hard time to regulate everything when it's still in the process of healing. So we don't want someone to make themselves more fragile or to put themselves at risk for long-term sequelae if they decide just to hide their symptoms and push through it or return too quickly. I understand that, being an athlete myself, I know what's going through athletes' head. They love their sport, they want to return, they don't want to miss out, or their fear of missing, being part of something, being part of the group. They don't want to disappoint a family member, a coach, a friend, a teammate who's counting on them to participate, or has really, been pushing them along, and they feel that they owe it to them. Also, some athletes feel like they have a pressure to compete at the next event, and if they don't train now, they're not going to be ready, or they try to, if they get injured in the event, they want to keep going because the event will allow them to get points or standard or open doors for future opportunities. But if they're injured going to these future opportunities, it's not going to give them any better in the future, because they'll have to have a longer road of recovery. So though an athlete can say they're asymptomatic, I always question them further and making sure I tell them why it's important that they have to be telling the truth and what the symptoms are. It's how the brain is telling us how the level it feels, because we can't see it. We can't really test it other than, some cognitive tests and nutritional tests, but the athlete has to tell us how they're feeling. What also makes it tricky is that an athlete can be asymptomatic, but not yet fully recovered. So the brain, it does heal gradually. So they may be asymptomatic doing some easier tasks, but then when the intensity or the volume or the combination of the both gets to a certain point, sometimes we can pass that threshold and symptoms can start. So it could be a shock to some people that they were fine the day before when they did a hard training for an hour, but when they try for, a little bit, maybe not the same intensity, but for longer, they get symptoms, or that's a little bit shorter, but higher intensity, they get symptoms. So sometimes it can be a little bit confusing for the athlete or the people working with it, because it's not always the same. It's not always a linear progression, and the asymptomatic doing one thing doesn't mean you're going to be asymptomatic doing the other thing. So it's like similar to any other injury. There's a spectrum, and the progressive return and trying different tasks at different intensities over this spectrum of the protocol does allow the brain to help heal and manage the increased demands. So just to give like a simile, I guess I could say, think of it as a gas tank. So when you have a quarter of a gas tank full, you can still run your car, but if you decide to go on the highway, you probably wouldn't be going so fast so far. If you have half a gas tank, so you've recovered a little bit, you have a little more gas in the tank, you can do a little more, go a little bit farther. And same thing, if you have a full tank, you have open road ahead of you. You can pretty much do anything you want inside the speed limit. But if you get the picture, it's the same thing as the brain. So a lot of times people feel that they're ready, but they might only have half or 3/4 of a gas tank. And when they really try to push themselves, or they put themselves in situations where they need that full gas tank, that's where sometimes symptoms can return. So just to make sure that, again, the education piece, people knowing what a concussion is and knowing how to manage it, it really will help prevent some of the longer term symptoms from sticking around. So I'm just going to go over some risks that we see in the training environment as well as the competition environment. So as you see, the risks are multifactorial, and I couldn't list them all, but I list kind of the main categories of some. So if someone is fatigued or deconditioned, it's putting them at risk of a concussion. And people ask why, usually it's because they have a slower reaction time and they make poor decisions or have poor reactions to the situation in front of them, because they're essentially surviving with the physical effort that their brain can't use any of its capacity to make the fast reaction or to make the right choices in the sporting environment. So this puts them at risk of having those injuries. There's an unequal skill level between partners or participants. So again, this happens sometimes when you have people who are a little bit more experienced versus people who are not. There is a higher risk for the lesser experienced individual to have injury. If there's a significant difference in weight category, I know this is tried to be avoided, but sometimes people like to train with their friends or like to, try fighting someone else who's in different categories, things like this. So having a significant difference could also put the person who's usually in the lighter category a little bit more at risk. A significant difference in the physical capacity or the development. So again, this happens when we're trying to match people who are of the same weight category, but you have someone who's a little bit more mature physically. So I'll give an example. You have a 16, 17-year-old boy who's, quite a large physical format. So he's up in the 90 kilos, but then you have someone who's maybe in their mid to late 20s, who's also in 90 kilos, but has had time to physically mature and get stronger. Usually they have a little bit more ability, and it's more of a risk for the individual who has less experience or has less physical capacity. And last one I'm going to go over is the not wanting to be removed from the training, or the fear of missing out on upcoming competition, or the fear of not being prepared. So this brings back the hiding symptoms or trying to push through symptoms if there is a concussion involved. In competition, they're similar. So you still have that fatigue or decondition risk in equal. We took out obviously the one for the unequal weight categories, because most competitions do class them in similar weight categories, but you have to look at when there's smaller competitions, sometimes they do group weight categories together. So to be cognizant that there is that small risk in certain competitions. Same aspect of the significant difference in physical capacity or the development of the individual, and then not wanting to be removed from competition because the result could mean something important. They're there to compete, they love their sport, and they just want to keep going despite their symptoms. So again, really multifactorial. There's lots of interconnections on why there's risks and how they can impact getting a concussion. So in summary, we can help by preventing concussion occurrence by being aware and acting on the modifiable risk factors that we can see in front of us. In situations when concussions do occur, proper management is critical for adequate care and the optimal return for school and sport. It is important to understand that every individual will respond differently and not present exactly the same. even if it's the same individual with multiple concussions. A concussion that happened 2 years ago might not have the same signs and symptoms that they have in the concussion they have today. And also, it's really important that you, as well as other athletes, don't try to compare themselves with other individuals, because every individual is different and everyone will heal differently. Lastly, hopefully by filling out the concussion reporting form, we will be able to gather some more data around concussions that occur in Canada in the sport of judo, and to better understand them and to better then develop and implement better and more pertinent prevention strategies. So just to let you know, we do have a resource page full of our concussion information, as well as the poster, or the downloadable poster for the intervention plan, as well as the concussion information poster that's on there. I believe some clubs also received the concussion information poster in the mail last fall. We have all our policies and protocols. We have some concussion resources, including the education letter that can be used pre-season. There's also links and other resources to free trainings. The University of Calgary offers an English free module about concussion, so does the University of Laval in French. There's tons of great links onto the Sport Information Resource Center, or CIRC, about concussion. Parachute Canada has a lot of information about concussion and the policies across Canada. Yeah, so I hope you can go and look at some of the resources we have developed and provided for you there. If you do have a specific question or a case you want to discuss, I'm open to discussing with you, contacting. So feel free to contact me by email. My email is here on the slide, but you can also find it in the Judo Canada staff, contact list. I'm open to try and help you as much as I can at a distance. And if you have questions, feel free to reach out. I'm really here to help athletes get back to their sport, and so that they have a great time participating in judo and in a safe and friendly environment. So I will move on to any questions. If people have questions in the chat, or if they feel like unmuting their mic and opening up so everyone can hear their question, that would be great. And
yes, Steve, we have a question. We have a question from someone wants to know if there are some exercise specific to avoid and to prevent some concussion, like strengthening the neck when you fall on your head. Do you recommend some exercise?
So there has been some research done, and there is some positive correlation that a stronger neck does seem to help the concussion prevention. It will not be you strengthen your neck, you won't have concussions, but there has been research found that having a strong neck or good stability in the neck actually does help prevent some of the occurrence of concussion. So yes, definitely working on neck stabilization is a good idea, but it will not prevent all concussions, but it may help prevent some.
And do you have specific exercise? Like if we think of the neck exercise to strengthen it?
So some of the most common ones that can be done will be more of an isometric. So it means a stable contraction. So either they can use their hand and just push against isometrically for a few seconds in each direction. So, side flexion to side, flexion forward, extension, and rotation. So doing a few sets of resisted isometric could work. Working on the deep stabilizing muscles of the neck. That's a little bit hard to show on a video because the muscles are so deep and the little movements are very precise, but those can also help as well because they help stabilize, especially the upper neck region. Having strong traps and making sure that, the trap muscle, superior trapezius muscle, runs from the corner of the shoulder up to the base of the skull. It does help just stabilize the neck a little bit. It's kind of hard to demonstrate some exercises just over a Zoom call, but I'm sure if you're working with any physiotherapist or strength and conditioning specialist, they'll be able to give you some more concrete examples.
We can talk also about the safe warm-up poster that we recently did, because it goes in the same idea of to avoid regular judo injuries. You have to follow specific orders of exercise when you want to warm up. And those exercises include also specific exercise for the neck, also other kind of exercise, but it's interesting to see the poster that we produced. And normally that club should receive in a short time. I don't know if there are other questions.
Hi there. I'm Ersan Instagram joining from Vancouver. I have a question about the awareness around concussion among athletes in general. Some judo moves, I think, tend to cause certain types of injuries more frequently than the other judo moves. And sometimes judokas are not aware of them. So do you think we would need some sort of a training for athletes in general? What moves that they do would cause concussion in their partner, like, okay, and what kind of attention they should pay to for those specific moves? That's my question. Would you guys think about coming up with a kind of a training module for all the athletes, and they would go through the specific injuries that happen in judo, like particularly in this case, concussion, and how they could be more careful, especially during randori time. I understand competition is competition, but even there, I guess there should be some awareness. Do you have any ideas about or anything that Judo Canada would develop around this idea?
So definitely a good point that you brought up. It's kind of the basis why we have developed the concussion reporting form, was to get more concrete information around how concussions are occurring in Canada. There has been some studies internationally, but again, really small numbers and small, we call it power of research. So just to get the more information we get on how concussions occur, the more we'll be able to provide these resources and teach these athletes. But for sure, we are aware that there's some techniques that are slightly more dangerous or at risk for athletes who are being, the uke. However, right now, because we don't have any concrete data, it would not be, I guess, the right timing for us to start planning these modules. But I definitely agree, like education and awareness of how these techniques should be done, or in certain circumstances, because the intensity that the technique is done does also, or can also play an impact, or have a factor, impact the outcome of the injury. So I agree with you. It's a super great comment to bring up. We hoped that based on the information we receive, we will be able to start these kind of planning, but until we have the information, it's hard for us to make these assumptions. So we have to try to work from the bottom up to make sure we have the good data to then be able to concretely make these assumptions. But thank you for your comment.
Yeah.
It's the driving force of why we're doing this, the questionnaire, and eventually, hopefully we'll do it for more injuries, but we're starting small on concussion. It's quite an easy injury to isolate, but again, having this data will allow us to do more injury prevention.
Yeah, just a quick addition. Qualitative research may help more. Like, I know 4 people, 2 of them elite athletes, were removed. Like, they stopped basically doing judo. One of them gave a long break. That's in Ottawa. And in Vancouver, really elite athletes stopped doing judo for a good while. So if you ask them, they will give the answer. Here's how it happened. Here's how things developed. Here's my mistake in maybe falling, but here's the intention of the other judoka, I think. Here are some observations that I have about other injuries. That would give immense amount of data and insight, rather than like responding maybe. So just to give that other kind of venue for research to collect information. Years ago, it was teguruma. As people were doing teguruma, I've seen many broken arms, like in 1990s. But there are 2 mistakes, like you shouldn't put your arm maybe, and there are other responsibilities maybe of the tori about how to do teguruma correctly. Yes. Anyway, so this kind of information could be collected and awareness could be raised among the judokas more widely, so that we stop this based from its causes, right? The cause is there to interacting individuals to consciousness. So Thank you
Yes.
for this session, by the way.
I'm glad, like, again, we're really trying to, have athletes participate in judo safely, and we're trying to get as much prevention to prevent things that we can prevent. So we're looking at many avenues to collect this information, but thank you very much.
Tiffany, we have a question also regarding can the concussion management be also applied in response to strangulation? If an athlete gets strangled, if he couldn't tap or lost consciousness or anything, can the concussion come into place, the concussion prevention plan?
So having a strangulation or a choke, so it's definitely a different injury. One is, so when someone actually has a choke, they're actually cutting off the blood supply to the brain. So that is why the person goes unconscious. So a gradual return would be not a bad idea, but it's not always necessary in all cases. It would definitely be the prudent approach. And I know that there's rules in Canada for younger athletes, so U18 during a competition versus a senior in a competition, if a choke rendered someone unconscious. So if it does happen in training, usually depending on the situation, you want to make sure that the person has fully come back to full consciousness, that they feel okay, that they have full range of motion in their neck, that they have no neurological symptoms, no vascular symptoms, that they've been monitored for a few minutes before that's if they decide to go back to the same training. Usually they're a little bit apprehensive and they prefer not to go back to training that day, but a graded return is definitely warranted to allow them A, to gain confidence, and B, to test out if they have any symptoms related to that strangulation.
Okay, thanks. I think there's another question also regarding parents of athletes who bring back too soon their children or the athlete, in case of coach, to the competition or to the training. I mean, as a coach, if you see an athlete coming back knowing that the week before he had a concussion and he's coming back to train, and he's coming back because his parent told him, okay, you're okay, you can come back to train. We've followed the tool that we've seen online. I mean, what is the position of the coach? Does he need to have specific papers from a doctor to allow the athlete to come back to train? What is the position of the coach in such situation?
So in our resources, we do have a medical assessment letter and a medical clearance letter. As a coach, if you feel that they have not done the appropriate steps, you definitely have the ability to not allow them to train. It might not make the parents very happy, but if you're saying the reasons why, it's because it's for the safety and the security of their child, and fully explain why you feel that they need to follow either certain steps or be consulting with a medical practitioner to ensure that they are medically able to come back to sport. I think that's a good idea. And again, use the resources we have online. There is a template for a medical clearance letter if you would like them to, it can be brought up as a pre-season education, that these are the forms that need to be completed by the specific people prior to returning if you've been diagnosed with a concussion, et cetera, et cetera. So as a coach, if you don't feel comfortable to have them on the mat while you're training, you should definitely speak up. Again, we're all here to ensure the safety and security of these individuals participating in judo.
I don't know if anyone has any question. Don't hesitate. I mean, we have the chance to have Tiffany with us. So if you have a question, otherwise, I think we're gonna, maybe someone. Then if you don't have any question, I think we can conclude this webinar. Maybe conclude it first by telling you that our next webinar will be on the long-term development model. We do not have the date yet, but we will inform you of the date when we know it. And we're also thinking of other webinars to organize, and we'll let you know when it will be the case. For the rest, thank you again for your time, and we wish you a very nice Sunday to you all. Thank you.
Thank you.
Thank you.
Bye, everybody.
Thank you.